But right now we're going to talk about men's health, and I'm very pleased to welcome to the show Dr. Elterman. Good morning, or good afternoon, doctor. Are you there? And Dr. Elterman is a part of the UHN, University Health Network, and he is the medical director of the Prostate Cancer Rehabilitation Clinic at Princess Margaret Hospital. And so we just would love to welcome the doctor to the show. And I think we're having some technical difficulties.
It's just frozen.
Okay, yeah, so we're still trying to do a lot of these interviews via Skype, and unfortunately sometimes the technology just is a little bit demanding. But I think we're here. Doctor, are you there?
Yeah, I'm right here.
Hi, doctor. Welcome to the show.
Thank you.
I was just mentioning that you are the medical director of the Prostate Cancer Rehabilitation Clinic at Princess Margaret, and we're very pleased to have you join us today. We're talking about men's health, and I wanted to ask you about yourself, what you do, your research, and how it really is specific to men's health.
Well, thanks very much for having me. It's such a pleasure to be able to join you today, to have the opportunity to talk about men's health during Men's Health Month. I'm a urologist, and I work at the University Health Network, which is essentially the local hospital to much of the downtown community. And urologists really specialize in men's health. We see a lot of men coming in for the first time. And my particular interest is in male prostate health. And it really extends from that to all matters relating to men and taking care of their well-being.
Can you tell me, are men good patients in the sense that, are they aware of their symptoms? And so what are some of the challenges that you face treating men?
Well, I think, men as patients can be a little bit challenging. I think from a society perspective, we have this feeling of machismo, being able to take care of ourselves and everyone around us, our families. And it's very difficult for men sometimes to admit that they need help or that they have some vulnerability. So historically, and even now, we see a lot of men avoiding coming into the doctor, avoiding even admitting that something is bothering them. And so one of the challenges of men's health is getting men to open up about their problems and come on in to see us, and then we can take it from there.
Yeah, men tend to downplay their symptoms and either just hope they'll go away on their own, or just not really pay much attention to it. So I think it's really important. So what are some of the main issues your research aims to accomplish?
So what we really started to do at the UHN is focus in one area, and it's really expanded. And I have to say a lot of that is through the help of working with the UHN Foundation, who brings in finance to help support our research. My main area of research was men who have enlarged prostates, or what's called BPH, or benign prostate enlargement. And it's a really common condition. In fact, it affects more than 50% of 50-year-old men, and it goes up to 80% of 80-year-old men. So it's the actual number one reason to come in to see a urologist. And what we found through our research was that urinary symptoms were the thing bringing men in to the doctor for perhaps the very first time in 10, 15, 20, even 30 years. So what we discovered really is that the urologist often is the opening, the portal for men to re-engage in the healthcare system many years later because they have a prostate problem. And so that really expanded our idea of, well, now that we've got men into the office for the first time perhaps in their lives, can we check them out? Can we get them seen by internal medicine, cardiologists, assess their weight, their smoking, all these lifestyle things that were previously left behind?
Yeah, I'm glad you touched on that. So what are some of the tips and tricks that you pass on to men in helping them avoid some of the common problems that they encounter?
Well, a lot of men come in and they're worried about their urinary function, their prostate health. Everyone's worried that they have cancer, which is a very scary thing to think about. They're worried about their sexual health. And some of the advice that we tell them is, what's good for your urologic system is good for the rest of your body. So when men ask me, what can I do to be healthier from a urinary perspective, for example, We say what's good is also good for your heart. So good sleep patterns, a good diet, exercise, losing weight, all of these things that are going to help with our longevity, lead healthy, good quality of life, is also going to help with urologic issues. And so that's really what we try to bring home is, yes, there's specific things we can do to make you pee better, for example, but the general lifestyle recommendations really have far-reaching effects on men.
And how important is it for men to visit their doctor or their urologist and get a PSA test?
It's really important. You know, we know that PSA can be very helpful in finding prostate cancer early. Prostate cancer is the #1 cancer affecting men around the world, affecting men in Canada. About 1 in 7 to 1 in 8 men will be diagnosed with prostate cancer in their lifetime. So PSA is a simple blood test, and what it does is it gives us a little bit of an indication if it's elevated that perhaps there's something going on in the prostate that needs to be investigated further. So it doesn't need to be a scary thing, but really you need to come in to at least see your family doctor to get something like that test done as part of routine health screenings.
Yeah, I know most men were reluctant to go in for a prostate examination because it's rather uncomfortable. But the PSA test, which is the blood test, makes it much more simpler and gives you the medical professionals the kind of information that they need to properly treat their patients. So that's a good thing. Last question: how can community members do more and help in your research?
Well, we really want to be a member in our community. We're close to Little Italy with the UHN being downtown, but we also have global reach. We are the #1 public hospital in the world and #3 hospital in all of the world, and it's really due to the support we get from community members. The UHN Foundation receives donations from patients, and it could be as simple as $1 and going all the way up from there, and that's what helps us be the #1 research hospital in the country. It supports us to be able to do these clinical trials and find out more about men's health and all of the other aspects that makes the UHN a really special place, certainly in Canada.
Thank you, Dr. Elterman. UHN is really a wonderful institution. Chin Radio is very active in support of all the work that they do, in particular from Princess Margaret. And once again, I want to thank you very much for sharing some of your knowledge and most importantly, your time with our audience and passing on these great tips regarding men's health. So thank you very much, Doctor, for being on the show.
Thank you. It's my pleasure.
Okay. That was Dr. Elterman and from UHN speaking to us about mental health. That as well, but men's health is just as important.